Hi all, welcome to Oet Speaking. Today we can discuss an Oet roleplay. Here the setting is a community health center. You are talking to a 35-year-old man who presented with mild fever, nausea, vomiting and tiredness. Task: inquire about current problem before seeing the doctor. Tell him that you suspect hepatitis A. Explain the importance of blood test to confirm the diagnosis. Explain about hepatitis A and how it spreads. Inform the duration of illness, about 1 month to recover fully. Arrange consultation with General Practitioner. Here, the setting is a community health center, so the patient is unknown to you. You can start your conversation by saying, "Good morning, please be seated." Then you can introduce yourself. You can tell like, "My name is Sarah. I am one of the registered nurses working in this community health center. How may I address you?" Let's assume the name is Mr. John. Then you can ask him like, "What brings you here today?" Alright, Mr. John, what brings you here today? Probably as per the interlocutor's card, he may tell you like, "Sister, I have been feeling tiredness for the past 2 days." At that time, we need to reassure the patient. So you can tell him like, "Oh, Mr. John, I'm so sorry to hear that you are experiencing severe tiredness. Try not to worry. As you are in the right place, I can help you." You can reassure him by saying, "Oh, Mr. John, I'm so sorry to hear that you are experiencing severe tiredness. Try not to worry. As you are in the right place, I can help you." Then, as per our first task, we need to inquire about current problem. So you can ask question like, you can say him like, "Mr. John, before seeing the doctor, I would like to get more information about your current problem. Is that okay?" Or you can ask, "Mr. John, could you tell me more about your problem?" Probably at that time, patient may tell you, "Sister, I am having mild fever, feeling nauseated, and I vomited a couple of times." Then we can ask next question like, "Apart from that, any unusual symptoms are you experiencing? Are you experiencing any other problem associated with this?" Probably as per the interlocutor's card, he may tell you like, "Today morning I noticed that my eyes have turned a little bit yellow and my urine is in dark color." Then as per our second task, we need to tell him that I suspect hepatitis A based on your information. So we need to ask the questions like, "Have you eaten any food from outside or any contaminated food? Did you travel recently?" These questions we can ask one by one because this hepatitis A spreads through contaminated water and food. So in order to collect the information from the patient, we can ask questions like, "Are you experiencing any unusual symptoms associated with this?" Then you can ask, "Have you eaten any food from outside? Did you travel recently?" Probably as per the interlocutor's card, he may tell you, "Sister, recently I traveled to another country, but I have taken all the precautions. And I remember I had some local food." And as per our second task, we need to tell him that you suspect hepatitis A. So we can tell him, "Mr. John, from your words, I can understand that you just traveled to another country and when you came back, you are having mild fever, vomiting, yellowish discoloration in your eyes and your urine also dark. Is that right? Based on this information, I suspect that you are having hepatitis A. It's a viral infection. Have you heard of this?" Probably the patient may tell you, "Yes, sister, I heard of this, but I don't know much about this." We can tell him like, "Don't worry, Mr. John. There is nothing to be alarmed about. We can effectively manage this condition with the help of medication." Then as per our third task, we need to explain the importance of blood test, liver function test to confirm the diagnosis. So you can tell him like, "In order to confirm the exact problem, it's really important that you need to undergo a blood test which is called liver function test. Is that okay?" If the patient is anxious, then we can reassure him by saying, "Mr. John, there is nothing to be alarmed about. There is no need to be worried about this test. And it's a simple blood test. Once we confirm the diagnosis, we can Treat as per that. And for the sake of your health, it's really important that you undergo this blood test. Is that okay? As per our next task, we need to explain about hepatitis A and how it spreads. So you can tell him like, Mr. John, I do completely understand your worries. There is nothing to be worried about. Let me tell you what is hepatitis A infection. It's a viral infection which spreads through contaminated food or water. Regarding the treatment, you need to take medicines to relieve your symptoms. That is, symptomatic treatment is available for this condition. Probably at that time, patient may ask you about the duration of treatment or the recovery period. Then, as per our fifth task, we can tell him like, alright Mr. John, your concern is valid. Let me assure you that you will get a complete recovery within a month. Sometimes patient may ask you, sister, is it a very dangerous situation? Then we need to reassure him by saying, it's not very dangerous if you take proper care and if you take proper rest, taking the treatment properly, then you will be having a complete recovery within 1 month. Are you following me? Then as per our last task, we need to arrange consultation with the general practitioner. Before that, we can ask the patient, okay, Mr. John, do you have any more concern? If there is no concerns, you can tell him like, as per our last task, we can tell him like, okay, Mr. John, then I will arrange consultation with the general practitioner as soon as possible. Okay, thank you, Mr. John. I hope I have addressed all your concerns. Once again, I assure you that if you follow our recommendations, you will recover fast. Thank you, Mr. John. Get well soon. In this way, you can end up your role play.